Okay, guys. So we're done with internal carotids. Now we're going to do the external carotid. This is probably where people are kind of getting stressed out over the arteries. So I'm going to provide just little summaries, and hopefully it's enough to grasp some knowledge, and then you can find some further knowledge in it. So the mnemonic that we're going to use is some anatomists like freaking out poor medical students. I feel like it's the easiest one just because it kind of applies to us. So you can say it with me. Superior thyroid, ascending pharyngeal for anatomists, so some anatomists. Lingual is like, facial is freaking, occipital is out, maxillary is medical, and then superficial temporal is students. So these two guys are terminal branches, maxillary and superficial temporal. Should know that. There's not a whole lot that I wrote down because I'm gonna make a specific video for facial and maxillary, and then I'm probably gonna throw lingual into one of those. Lingual is not that complicated, but the facial and maxillary, I've created mnemonics for those. Maxillary is probably the toughest. So all of these are pretty straightforward. So this superior thyroid, what would you expect but for it to go to the thyroid gland and then the SCM, or the sternocleidomastoid mastoid? So it travels through this thyrohyoid membrane, which is connective tissue. It has one branch, and it's the superior laryngeal. And that's really all you need to know, in my opinion, for it. Okay, so this brown, which is kind of an ugly brown, it's the ascending pharyngeal. And what would you know that it supplies the pharyngeal wall? So think of like your pharynx, and during those lectures, what's in there? Your tonsils, your soft palate, your eustachian tube, and the levator palatini. Really, that's, honestly, all you need to know on that. So lingual, facial, and maxillary, like I said, I'm going to skip. Occipital is pretty straightforward. Think of your eyes, think of suboccipital triangle that we have. And so another thing to note is this occipital and this postauricular, there are kind of posterior arteries in this external carotid artery. So think maybe back of your throat and towards the back of your head. Postauricular, post and then auricular being behind the ear. So just think that it supplies the back of the scalp. We're going to skip this guy. And so the last one is going to be this superficial temporal. It's one of the terminal branches. It has one branch directly off of it. These are just bullets, but it has a transverse facial. And really all we need to know is that it exits the parotid gland. When we talked about the parotid gland in our lectures, this is something that we talk about, that it is the arterial blood supplies the transverse facial. It also supplies the TMJ, and that would make sense because it's right next to your TMJ. Your parotid gland and your TMJ are right next to each other. And like I said, it's one of the two terminal branches. So now I'll probably do lingual facial in one video, and then we'll tackle the maxillary.